Chronic joint pain is the most common reason adults seek medical help worldwide. And the standard answer, anti-inflammatory drugs taken daily for years, damages your stomach, kidneys, and heart. 12 plants address joint inflammation through the same molecular pathways as pharmaceutical drugs, without the organ damage. Today I am showing you all 12. Let's get into it. Plant 1, turmeric. The COX2 and LOX dual inhibitor joint inflammation operates through two primary pathways, COX2 and 5-LOX. NSAIDs like ibuprofen target COX2 only. Turmeric inhibits both simultaneously. Curcumin inhibits COX2, reducing prostaglandin production, while also inhibiting 5-LOX, reducing leukotriene production. This dual inhibition produces broader anti-inflammatory effects than standard NSAIDs. Multiple clinical trials confirm curcumin reduces osteoarthritis pain and stiffness comparably to ibuprofen without gastrointestinal damage. Take standardized curcumin with black pepper and fat daily. Think of it as the anti-inflammatory covering the molecular territory ibuprofen covers. And then some. Plant 2, Boswellia. The cartilage protector Boswellia does something no NSAID can do. Beyond reducing inflammation, AKBA in Boswellia resin inhibits MMP3, the enzyme breaking down cartilage. NSAIDs reduce pain, but do not address cartilage destruction. Boswellia addresses both. Multiple clinical trials confirm Boswellia reduces joint pain, stiffness, and swelling in osteoarthritis and rheumatoid arthritis. One trial showed Boswellia outperformed celecoxib, a prescription COX2 inhibitor, for knee osteoarthritis. Take 300 to 500 milligrams of standardized Boswellia extract daily. Think of it as the joint medicine fighting both the fire and the structural damage the fire has been caused. Plant 3, ginger. The triple anti-inflammatory ginger inhibits COX1, COX2, and 5-LOX, simultaneously the broadest anti-inflammatory pathway coverage of any plant on this list. This triple inhibition produces comprehensive joint inflammation reduction that no single pharmaceutical NSAID can match. Studies confirm ginger reduces osteoarthritis knee pain, reduces inflammatory markers in rheumatoid arthritis, and decreases exercise-induced joint inflammation. Unlike NSAIDs, ginger has gastric protective rather than gastric damaging effects. Use both fresh and dried ginger daily in food or tea. Think of it as the 3-in-1 anti-inflammatory covering every pathway without damaging the stomach. Plant 4, devil's claw. The African joint healer devil's claw grows in the Kalahari Desert, where it has been the primary joint pain medicine of indigenous San people for centuries. European health authorities have approved it for musculoskeletal pain for decades. Harpagophytum inhibits TNF-alpha, a primary driver of joint destruction and inflammatory arthritis. Clinical trials confirm devil's claw reduces pain and improves function in osteoarthritis and lower back pain, with a favorable safety profile compared to NSAIDs. Take standardized devil's claw extract for joint pain relief with European regulatory approval behind it. Think of it as the Kalahari joint medicine that European authorities approved while American medicine still calls it alternative. Plant 5, willow bark. The aspirin without stomach damage willow bark provides aspirin-equivalent anti-inflammatory and analgesic effects for joint pain, with the gastric protective cofactors that pharmaceutical aspirin removed. Salicin converts to salicylic acid in the body, inhibiting COX enzymes and reducing prostaglandin production in joint tissue. Clinical trials confirm willow bark reduces lower back pain and osteoarthritis pain comparably to conventional NSAIDs, with significantly fewer gastrointestinal side effects. Take standardized willow bark extract for chronic joint pain management that is safe enough to take every day. Think of it as the sustainable joint pain solution, without the organ damage that accumulates over months of NSAID use. Plant 6, bromelain. The enzyme anti-inflammatory bromelain from pineapple stem works through a completely different mechanism. It breaks down protein aggregates and fibrin deposits accumulating in inflamed joint tissue, physically reducing swelling and improving joint mobility. Studies confirm bromelain reduces post-surgical swelling, reduces joint pain and stiffness in osteoarthritis, and has anti-inflammatory effects comparable to NSAIDs. European physicians have prescribed Bromelain as a pharmaceutical for surgical swelling reduction for decades. Take Bromelain on an empty stomach for systemic anti-inflammatory effects. Think of it as the enzyme physically clearing the debris from inflamed joints, doing something pharmaceutical anti-inflammatories simply cannot do. Hit that like button and subscribe. Every week we reveal natural joint solutions that pharmaceutical companies have no incentive to promote. The next 6 plants include the cartilage rebuilder. Keep going. Plant 7 Rosehip. The vitamin C and galactolipid source Rosehip contains galactolipid that inhibits the migration of inflammatory white blood cells into joint tissue. It also provides vitamin C essential for collagen synthesis in cartilage. Multiple clinical trials confirm Rosehip powder reduces osteoarthritis pain, stiffness, and disability. A meta-analysis of 3 randomized controlled trials confirmed Rosehip significantly reduces pain scores in hip and knee osteoarthritis. Take standardized Rosehip powder daily for GOPO-mediated inflammation reduction and cartilage collagen support. Think of it as the joint medicine with 2 completely separate mechanisms addressing inflammation from 2 independent directions simultaneously. Plant 8 Stinging Nettle. The TNF-alpha reducer stinging nettle leaf extracts inhibit TNF-alpha and IL-1B, 2 primary inflammatory cytokines driving joint destruction in both osteoarthritis and rheumatoid arthritis. Studies confirm nettle extract reduces joint pain and inflammatory markers in arthritis patients. Research shows efficacy comparable to NSAIDs for some joint conditions, with the ability to reduce NSAID dosage when used as an adjunct treatment. Take nettle leaf extract or drink nettle tea daily for TNF-alpha-mediated joint inflammation reduction. Think of it as the plant that stings on contact using that same biochemistry to sting the inflammatory mediators destroying your joints from the inside. Plant 9 Avocado-Soybean Unsaponifiables. The cartilage rebuilder ASU Avocado-Soybean Unsaponifiables stimulates collagen synthesis in cartilage tissue, inhibits inflammatory cytokines that degrade cartilage, and reduces the activity of enzymes breaking down cartilage matrix. A landmark clinical trial showed ASU supplementation significantly reduced joint space narrowing in hip osteoarthritis, a measurable reduction in radiographic arthritis progression that no anti-inflammatory drug has reliably achieved. France approved ASU as a prescription pharmaceutical for osteoarthritis in 1997. Take standardized ASU supplements for cartilage rebuilding and arthritis progression slowing effects. Think of it as the compound that not only manages arthritis pain, but slows down the arthritis itself. Plant 10 Collagen Peptides. The cartilage nutrient type 2 collagen peptides deliver the specific amino acids hydroxyproline, hydroxylase, and glycine that cartilage tissue uses as building blocks for self-repair. Studies show oral collagen peptide supplementation accumulates in cartilage tissue and stimulates chondrocyte activity, the cells responsible for cartilage maintenance. Multiple clinical trials confirm collagen peptide supplementation reduces joint pain and improves joint function in osteoarthritis. Research shows particular benefits for exercise-related joint pain. Take 10 grams of hydrolyzed collagen peptides daily for cartilage nutrient delivery. Think of it as delivering building materials directly to the repair crew working on your cartilage. Plant 11 omega-3 from flaxseed. The systemic inflammation reducer flaxseed contains alpha-linolenic acid along with lignans and fiber that collectively reduce the systemic inflammation driving joint deterioration. Studies confirm flaxseed oil reduces inflammatory markers including C-reactive protein and IL-6. Research shows benefits for rheumatoid arthritis, including reduced morning stiffness and tender joint count. Flaxseed lignans also have hormone-modulating effects, reducing inflammatory hormonal imbalances, contributing to joint conditions in perimenopausal women. Add ground flaxseed to food daily for consistent plant-based anti-inflammatory joint support. Think of it as the anti-inflammatory reducing the background inflammation, making every joint in your body more reactive and painful. Plant 12 Harpagophytum, the European pharmaceutical Harpagophytum. Curcumin's devil's claw is approved as a pharmaceutical in Germany, France, and other European countries for musculoskeletal pain and inflammatory joint conditions. European health authorities reviewed the clinical evidence and concluded it met pharmaceutical approval standards for arthritis pain management. American medicine classifies it as an herbal supplement. European regulatory authorities classify it as a drug. The clinical evidence is the same. The regulatory interpretation differs across an ocean. Take European standard devil's claw extract for the pharmaceutical-grade joint pain relief Europe officially recognizes. Think of it as the arthritis pharmaceutical that Europe approved, and America has not yet looked at carefully enough. 12 joint plants. Turmeric, Boswellia, ginger, devil's claw, willow bark, Bromelain, Rosehip, Nettle, ASU, collagen, flaxseed, Harpagophytum. 12 plants addressing joint inflammation through proven molecular mechanisms, some approved as pharmaceuticals in Europe without the stomach damage and cardiovascular risk of long-term NSAID use. Joint pain does not require lifelong organ-damaging drugs. Nature proved that long before pharmaceuticals existed. Smash that like button. Subscribe. See you in the next one.